Ninja likes to say you got to feel it to heal it, basically meaning you've got to push into pain to heal the pain. Okay, there's no point treating the muscle belly for this sort of stuff. You need to go into the tendon. Look at that, see that red mark? Look how effective that is by just getting blood flow, those bots into that area. G'day guys, Darcy Ninja here.
Hello.
Today we're revealing our secrets to fixing hamstring tendonitis or tendinopathy. So basically we've revealed that stretching doesn't work. You need to work the tendon. What is it? It's basically an overuse injury caused by running or loading in the gym and things like that. So what we do is we hold and pin that tendon to relieve the irritation. Normally people with hamstring tendinopathy, you'll feel discomfort when sitting down. It might be driving, it might be on the toilet, might even just be lying there where you feel like this really aggravated pain that's in that high hamstring. So I'm going to show you, Leo, where exactly. So you can see that we've got three hamstrings, our bicep femoris, our semitendinosus, and our semimembranosus. What is interesting about our hamstrings is they all originate on this ischial tuberosity, that sit bone. So to affect all three tissues or all three muscles, we're going to actually be treating right up high in under there, so right on that sit bone. So it becomes uncomfortable because it's really hard to avoid sitting down without sitting on your sit bone, right? So what I like to do is just use my elbow to begin with and go straight on to that bone, so right onto that sit bone. So go slow. We need to get a little bit high with that towel, and first of all we need to connect right in to that bone. So that bony landmark, we get feedback that my elbow is connecting onto that, and we pin it. What happens is we're starting to dissolve some of that tissue and some of that tension around there. Basically the hamstrings are pulling down on that pelvis, causing some irritation because we've overused it. We've overdone it with the running, we've overdone it with the load in the gym. Load in the gym is going to be good, and I'm going to showcase some interesting exercises later that will help to relieve some of these symptoms that you may be facing. So stay tuned for that after. But what I'm doing here to give you guys some feedback is I'm just pinning and holding that position there, eradicating some of the pain. So usually with hamstring tendon, there's going to be alarm bells. There's going to be signals going off that are telling us that there's pain. So to switch those off, we use sustained pressure and we hold it. Ninja likes to say you got to feel it to heal it, basically meaning you've got to push into pain to heal the pain. Okay, there's no point treating the muscle belly for this sort of stuff. You need to go into the tendon. So what I'm doing here is I'm working different angles and I'm starting to go sink. So I'm actually scooping away. Let me think about this. I need to go onto the tendon, onto the bone, and then I'm going to go, so I'm pushing up towards Ninja's shoulder. There's a bit of technique to this. So up towards Ninja's shoulder and then down, and we're doing like a scoop away off that bone, relieving what's pulling and tugging on that pubic symphysis. And as we saw, we can affect all three hamstrings with my elbow. My elbow's, let's say the space of my elbow is that big, while the tendons are all within that circumference of that circle of my elbow. So I can go a little bit more lateral, and I can also work down there.
That's good.
Yeah, so for Ninja, I'm getting feedback that it's probably more of an angle down and then a scoop out. Ninja doesn't have hamstring tendinopathy. He does have some tight hammies.
Yeah.
But for somebody that does, straight away they're going to be, feeling it. There's going to be alarm bells ringing that we're on the point of pain. We're going to get that connection straight away. Really good. You ever had hamstring tendinopathy, Ninja, or you're pretty good?
Pretty good. I have strained this hamstring quite a few times though.
Yeah.
There's a couple of really good ones, but they're like probably 20, cramping style ones, the grade 1 tear type things. Or so it has copped it throughout a period of time.
Yep. Yeah. So to get a better idea of which hamstring is Ninja's feeling is I'm probably working more medial, so his semimembranosus. one of the three hamstrings. Bicep femoris is more lateral and attaches on the outside of the knee. Semi-mem and semi-tem come on the inside of the knee, the medial portion. So for ninja, it's probably even like a tiny bit of adductus, groin stuff, but hitting it from the posterior aspect of that ischium. So pin and hold, and we're just getting blood flow. We're just allowing some movement through there. It has been irritated and sore, so we're just asking the body to heal. We're asking the body to respond by holding this pressure. Really good. And as I work more medial, there's no wax, there's no gliding, there's no cross friction stuff or that sort of work. It's elbow, pin, hold, sustain pressure, release that Golgi tendon. So the Golgi tendon is within the tendon. We need to work the tendon, the attachment site, the origin is the origin, and we need to hold that. So the Golgi tendon, meaning if I pin that spot, the muscle is actually going to relax the whole way through. It has that Golgi tendon response. So we need to hold it. We've worked in here for a few minutes. Maybe for the sake of the video, I'll slowly sink out and move on. I'll show you with the thumb. Look at that. Look at that redness. See that? That's really good. That's telling me that we're getting blood flow into that area. That's already telling me that whatever shockwave therapy or other therapies you may have, that this is already being more effective, because you can see that there's blood flow in there already. Blood flow is what delivers the cells and the oxygen to the muscle that actually has these tiny little, what would you call them? They're like your little bots that are going to work, cleaning away, working, getting the job done. In a world of AI and bots and things that are going on in cryptocurrency, I thought that might be a word that's relevant in 2024. Okay, so what I'm feeling here is a tight band. So I'm just showing you, I wouldn't do this normally. You can see that that's quite flicky. That's his tendinous tissue. So I sort of, on that with my thumb, I can actually go in like that and pin it. So I'll work a bit up high. I'm giving Ninja a bit of curry here. It's a real treatment. And then scoop down and away.
Yeah.
Oh, good, man.
That's it. It's good,
That's
man.
it. So we're more medial. We're right on the middle of it now. I am in up high into his bits, but we've got to go to these places. You need to explore. You need to have confidence in your own treatment, that you know that this is the right thing to do. And sometimes it's getting right up in their glute, right up under there to work the tendon. You're wasting your time if you're treating tendonitis by just flushing out the hamstrings. And the reason stretching irritates it, think of why we get this. It's pulling on the muscle, the tendon, is pulling on that joint, causing pain and inflammation. If we were then to stretch that and pull that tissue down, we're only going to aggravate it and add to what is already going on. So that's why you need to either get a ball, get a foam roller. I think a massage ball is best. There's a little purple one over there Leo can quickly flick to, or chuck me. Yep. So if you were to sit on that ball, you could really start to work it as well. You do need to be sitting on a chair. There's no point sitting down on the ground, but pinning that ball right into that spot is going to be more effective than just foam rolling or getting someone to give you skin a polish. Good. So it's not too bad out there. I want to actually go more, sorry Ninja, I want to go more like medial again.
Whoa.
Yeah, and I'm going to come from here and I'm going to work up. You also need to think of load management. So when you have these issues, overuse things, you need to revert to load management. What am I doing? Am I training 4 or 5 times a week and doing 60, 70 kilometers and just bashing the pavement with my runs? Let's offload the body. Let's give the body some time to calm. Sorry, Ninja.
All right.
Gives the body some time to calm down and heal. There's already so many stresses in our life because of work, relationships, income, finances, whatever else is going on for you at the moment, that recovery and looking after your body needs to be high on the pecking order. You need to value that. And you might be thinking you are doing the right thing by getting out and getting to the gym 5 or 6 times a week and adding running to that. You're probably overdoing it. You're going to end up with overuse injuries. If it's not in your hamstring, it might be somewhere else. So if you've got hamstring tendonitis, you need to look into your load management. You need to rest. I'm just going to use one thumb because I'm balancing on something really good there.
Yeah.
You need to offload that joint. Give it time to heal. Maybe spend some time in a sauna. Spend more time in an ice bath. Spend more time getting massage, body work. Less time stimulating the body with high amounts of stress. How you going there, Ninja?
Yeah, it's good, man. Good pinning.
Good pinning. Pin and hold. We are always giving ourselves feedback as practitioners here. We're trying to be the best we can. And we have conversations off camera, and sometimes it's, man, you need to be doing this, or you need to change your angle there, or you need to hold things. And Ninja was giving me some feedback previously, letting me know that it's probably a better idea to hold things for longer and use less wax. So this is a really prime example of when we don't need wax and when you do just pin and hold things when you have things like tendonitis. How am I doing, man?
Yeah, really good.
Really good. Resonates.
Yeah. Yeah, it is, like, from a practitioner type thing, it is quite hard to give feedback, and because you feel like they know what they're doing, they're experienced. Like Darcy's been working for 8 years or something. So yeah, like when you got to, I had to try and do it tactfully, and like just be it, it's for the greater good.
Yeah.
Because you don't know what you don't know. You don't have that reflection on yourself necessarily. You can, unless somebody can give you a little bit of feedback as how you could be maybe evolving and improving what you're doing. So yeah, we kind of encourage it, and even though it is a hard conversation, you can just say, maybe you can hold it a bit longer, or different things like that, and it just helps them think about things and get better results. So
one other area that I'm going to focus on. So I've given that whole bowl. So come over here, Leo. I've given from the medial part to the real tip. So that's the tip there where the bicep femoris, then we've got our semi-mem and semi-tem on the inside. I've had my thumb pushing on that, different angles and holding. Now what I want to do is come up onto the ilium and just focus on glute med for a minute. Sometimes our hamstrings and our glutes have this disconnection where they're not working together simultaneously. They're not doing their jobs. One's to extend the pelvis and hip, one's to flex the knee, right? So if they get confused in what their jobs are and their responsibilities because there's pain, we will feel compensation, and these compensations occur and our glutes start to either overwork and we start to get hip pain and lower back stuff. So that's why it's really important to take ownership of your injuries early. Don't just push them to the back. With this stuff, it's actually going to be really hard. Hamstring tendonitis is one of those things that you can't avoid not doing something about, because you can't sit on the toilet because there's something going on and you're leaning to one side, you're putting all your weight over here. You're going to do something about it, and you're going to come and see one of us at Melbourne Muscular Therapies, or you're going to get on the ball. So this one here is just pinning his glute. Did some heavy deads Monday, Ninja? Or
yeah, squats and deadlifts.
Squats and deads. So we're always loading our joints, but not overdoing it. Once a week with heavy lifts.
Yep.
Sprint fast, powerful, perform hard, and in between that there might be some movement every day. But yeah, we're not overstimulating. A few tips and tricks, take away as you please, whatever you like. But what got you to this point? All right. So work that glute. Maybe. Ooh, just kick the plant. Maybe I'm gonna look at that. See that red mark? Look how effective that is by just getting blood flow, those bots into that area. I'm going to come there, reinforce my treatment by pulling back, because you can see if I did that, look how far his body moves across. And pull him back into it and just pin and hold. A couple of minutes in here. What also runs through that area is our sciatic nerve. So sometimes our sciatic nerve is getting impinged or overused, and it also, you're going to start to feel nerve-like symptoms. You can feel it in hot, sharp. It might feel burny. So holding that spot where I was before is also just going to be relevant at releasing that tendon and the sciatic nerve. So getting feedback from Ninja that he's wiggling down there, I can tell that this is pretty uncomfortable. We don't need to overbear that and push harder. We're not here to cause trauma, we're here to heal. Little angle changes. And Ninja moving his foot's probably a way of dealing with it and actually helping him to get through what's challenging.
Yeah. You can kind of be a part of it, can't you, to help you hit the spots and or give myself a little break and go back into it.
Yeah. Really good. All right, and sinking out. Okay, the second part of this video will be the secrets to healing it. Will be loading that tendon, and I'll show you down in the gym how we can do that. All right, part 2 of this video. We've done the clean phase. It's up on the wall. Clean first, build second. All right, so we've cleaned the tissues out. We've eradicated some of the pain and some of the build-up and that signal into the brain. Now we build. So what we're going to do is we're going to activate that hamstring with an isometric hold. So we're shortening the tissue, but we're not moving the tissue like a bicep curl. We're just going to hold. So come up into a pelvic thrust, Ninja. We're going to go single leg, so bring this knee there, fantastic, and then you're dragging this heel towards his glute. This angle is really good. The further away this foot is to his bum, the harder it's going to be. The closer he is, the easier it's going to be, and we're going to get more glute fibers. We've already gone for 15 seconds. We're only going to go for 30, 35. It's quite demanding. We're really loading that hamstring and putting a lot of strain on that tendon. We're going to go for another 5, 4, get this one up high, 3, 2, 1, and rest. We're going to intensify that. You stay there, Ninja. We've got a foam roller. All right, same thing. It's a little bit more challenging. Go double leg. So using the forefoot, you're going to come up when you're ready, and 30 seconds. Nice. So what you're doing with this is just adding something that's a little bit got some movement to it. So it requires a little bit more stability and balance. The brain has to sense that there's not a stable platform or foundation. Okay, and now, Ninja, we're going to advance that for 10 seconds. We're going to go single leg. So bring that. 10, 9, 8, push through, man. 6,
I'm going to snap it.
5, 4, 3, 2, 1, and rest. So you guys have tendon problems. The way to fix them is not stretching. It's loading them with isometric holds. We're contracting the muscle. We're asking that tendon to strengthen, and you're going to have an analgesic effect. It's going to help the pain to go away. So give this a go. Make sure you try it. Thanks for watching. Like and subscribe, and we'll see you next time.